One of the biggest weaknesses has been state and local governments, which have laid off 450,000 Americans.
He wants another stimulus. He wants to hire more government workers. He says we need more firemen, more policemen, more teachers. Did he not get the message of Wisconsin? The American people did.
Public sector employment is a key issue as election season grinds forward. But as the pink slips keep coming for workers across all levels of government, it's creating a drag on the economy. I'm Peter Latman reporting for Business Day Live. As we await a Supreme Court decision on the Affordable Care Act, Eduardo Porter is looking at what it could mean for health insurance. But first, the private sector has been slowly adding jobs for almost 2 years, but that's not the case in the public sector, where state governments and local governments are shrinking. Joining me now to talk about what this means for the economy is Shaila Dewan. Good morning, Shaila.
Hi, Peter.
So today's the first day of summer. We're all happy, but your story kind of depressed me. You read about, here we are, I thought that the public sector was our savior in the U.S. economy, but your story talks about 40 kids per class in Cleveland, teacher furloughs in L.A., firefighter cuts in Muncie, Indiana.
Right.
What's going on?
Sort of the point is that, right when we're starting to see recovery, we're just getting all these government layoffs. And in the past, during recessions, government really has been the savior. If the employment level dropped during the recession, it grew much more during the recovery. Now we're seeing the opposite. It's just plummeting, and it's really holding back the recovery in a lot of places.
But because in 2009 with the stimulus, I guess things peaked.
Right.
Right, and then you have this jarring statistic in your story that said if government still employed the same number of workers in 2009 as today, the unemployment rate would be a full percentage lower?
That's right. Yeah, so you can see what a big drag it's been, not to mention the lost spending power of all of those middle-class workers.
Right, and now is there any, maybe we won't see anything before the election, but is there talk of more stimulus to gain more traction in the state payrolls?
Well, as you know, the president has been trying to do these kinds of stimulus measures. Right now he's proposing, I think it's $30 billion for teachers, cops, and firefighters. That would be aid to local government so they can keep those people on the payroll, and Congress just isn't having it.
And obviously this is a huge issue in the presidential campaign. They're probably talking about this article on the election trail this morning. What's going on there?
Well, we've already seen it become a huge issue. Obama said the private sector is doing fine, and then Romney said, Obama just wants more teachers, cops, and firefighters, and Americans don't want that. And both of them have backpedaled from those statements. They were sort of touching these live wires. Romney's statement was widely viewed as a gaffe because when we think about this, we don't think about teachers, cops, and firefighters as being the enemy. We think of faceless, bloated government bureaucracy as being the enemy. And right now, it's the teachers and firefighters that we're seeing facing layoffs.
Right, because those jobs are thought of as inherently good. They're middle-class jobs, and your article suggests that they're all being cut.
A lot of them are being cut, and it's local governments that are now really feeling it, and they've just basically run out of options. The states are cutting aid to the local governments because they're looking at their own budgets and saying
federal aid's being cut.
Federal aid's gone down because the stimulus has disappeared.
Yeah,
so,
well, I'm sure this isn't the last we'll hear on this issue.
Not at all.
Thanks for coming on.
Thanks.
We could get a ruling on the Affordable Care Act as early as this morning. The Supreme Court is examining a provision in the act that would require every American to buy health insurance. Earlier, I spoke to Eduardo Porter about what will happen to insurance should the provision be struck down.
The mandate might not actually do the job that the Obama administration thinks it will. And if that's the case, whether the Supreme Court strikes it down or whether it stays in place is not going to make a lot of difference for the healthcare law.
So if they do strike down the mandate, what does that mean for the viability of the healthcare law? If you're advising the Obama administration or they're all upset that the mandate got struck down, you might say, oh, don't worry about it?
No. I mean, the mandate is put in place for a reason. The reason is that under the healthcare law, insurers are going to be forced to insure you regardless of your health status. So for healthy Americans, it would make sense to actually drop their health insurance, not pay, and just wait until they got sick and insure then. because, insurers couldn't reject them. They would save all the money for all the years that they didn't insure. So the mandate comes in with a penalty, a fine, to fine you if you don't get insurance. And so that will, they hope, induce you to buy health insurance.
But you're suggesting that it might be worth paying the fine and remaining uninsured?
There's a couple of weaknesses with the fine. First, the fine is actually fairly low. And what's more, the government doesn't have a lot of tools to make you pay the fine if you just choose not to. I mean, they can't hold your wages or take criminal action against you. The administration would counter that. The mandate is going to work not just because it's going to hurt you in the pocket with the fine, but because it's going to create a new norm in society. People are going to insure just as they pay parking tickets or pay taxes or go to vote, because it's something that's done. That's what you do when you're an American. The problem with that is that you need to believe that the rules are good rules, or at least legitimate rules. We had a poll recently which found that about 2/3 of Americans wanted Obamacare to be repealed or partially repealed.
Right.
A lot of the analysis of health economists and those that have worked on this bill, they point to Massachusetts, where a mandate and a fine did actually work quite well in getting healthy people to buy insurance. But in Massachusetts, the healthcare reform enacted by Governor Romney was very popular.
There's obviously the chance that the entire law gets struck down, not only the mandate, which most of your column is about, but what happens then if the entire law gets struck down?
Well, then I would say we get the healthcare system that we have today, which has 50 million uninsured Americans. I mean, I think that would really be fairly disastrous.
That's all for today. Please follow us at nytimes.com for our continuing coverage of these and other stories. I'm Peter Latman, reporting for Business Day Live. Thanks for watching.